have officially passed the one-year mark of the coronavirus pandemic, and now there's light at the end of the tunnel, and it's not a train coming at us this time, folks. Yes, as Dr. Fauci says, the CDC guidelines could be loosened by the 4th of July.
Here to discuss is a man who needs no introduction, director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. Dr. Fauci, we are so happy to have you here. And yes, you just heard TJ say it. We heard you mention it, July 4th, giving new meaning to Independence Day. So what's it going to take for us to get there?
I think we're going to have to stay the course of continuing what looks like it's a very efficient rolling out of the implementation of vaccines. We're now between 2 and 3 million vaccinations per day. But as we all say and continually repeat, that does not mean we can pull back on our public health measures. We have to continue to implement them, the things we talk about all the time, the mask wearing, the physical distancing, and the avoiding crowded congregate places, including indoors and particularly indoors. If we do that, those two things together, we are heading in the right direction. There's always the challenge of the variants that we're all familiar with, but the best way to circumvent the variants is to continue to vaccinate as many people as quickly and as efficiently as possible at the same time as maintaining your public health measures. So given that, there is light at the end of the tunnel for sure.
And Tony, the recent news is focusing on these new kind of scientific guidelines about distancing in school settings, with the CDC saying that 3 feet may be as effective as 6 feet. You've said the CDC may soon update those official guidelines. What is the latest on that? And what do you think is the likelihood that then, if that's been shown in school settings, that we could go to a 3 feet recommendation for social distancing in general?
Well, Jen, a couple of things are going on at the same time. There was a study from Massachusetts that looked at situations in which children were spaced at 6 feet versus 3 feet with full mask wearing. And it showed there was really no difference at all in the infection rate when you wore masks in both situations. The CDC themselves are doing studies in addition to what we see from the Massachusetts study. And as Dr. Walensky has said recently, they are right now intensively looking at all of the data that they've accumulated and the data from outside studies, and they very likely will be making additional modification of their guidelines. But we want to make sure that they have the opportunity to really carefully scrutinize the data, because they need to be careful of making sure they get it right. But I think you're going to be seeing a modification reasonably soon.
We have been getting new recommendations, and yet we have not yet received a national recommendation to operate those vaccination centers 24 hours a day, 7 days a week. I have to say, your colleague, Dr. Jen, has been calling for that since the beginning of this pandemic. Why hasn't that happened yet?
You know, I really can't, give an answer to that, because I have not had the discussions specifically regarding the 24-hour issue. But I can assure you that in the discussions that we've had with the medical team and the White House team, that they are doing everything that we feel we can possibly do from the standpoint of the community vaccine centers, the community health centers, the mobile units, the pharmacies. I can't really accurately answer your question about why it hasn't been 24 hours. I can check that out, and I'd be happy to get back to you on that.
All right, we're going to hold you to that. So we'll check in with you tomorrow. We expect you back here. But Dr. Fauci, some blood centers phasing out convalescent plasma donations. What's the right move there when it comes, as we see more people, of course, unfortunately having coronavirus, but also more people getting the vaccine? What's the future now when it comes to convalescent plasma donations?
Well, if you look at the data of convalescent plasma, even though it has an emergency use authorization, the fact is that the data are mixed. If you give it very early in some studies, that you can have some effect. But several studies have recently come out and shown that there really is not any beneficial effect from the standpoint of mortality and time to get out of the hospital.
And Tony, I can't believe it's been over a year that I was down at your lab at the NIH. We were looking at the very early vaccine development from Moderna and the NIH. Now there are, of course, 3 authorized vaccines, more expected. What is the early data showing about durability with these vaccines? How long does the protection last? And what about the need for a booster or different strain containing vaccine down the road? What do we know?
Okay, all very relevant questions. We know, given the short frame of time that we have to evaluate the durability of the antibody and other immunological responses, we know that it's at least about 6 months. Beyond that, we have no way of knowing because we've only been doing this literally for part or most of a year. So that's the reason why the studies themselves go out to 2 years.
Dr. Fauci, one other thing here. How are you doing? And I ask that. I know you're focused on science. You're focused on saving the world. But Dr. Fauci, how are you doing? And specifically, how has your life changed maybe a little bit with the new administration? And also, it's a year of pandemic. Everybody's going through something. And even a lot of us have lost people we've worked with, friends, family. What has that been like for you as well? Just how are you doing, my man?
I'm doing okay. I'm doing fine. I mean, to say that I'm not under continual stress every single day would not be honest with you. I am. It's a very stressful situation. As I've told Jen, privately, I haven't had a day off in over a year. And that's not hyperbole. That's just true. But that's okay. There are a lot of other people that are putting in a lot of effort. Every time you even get a glimpse of feeling sorry for yourself, you got to think about what people are going through who've actually been infected, who've lost loved ones, who suffered. And you have to think of the healthcare providers that are going through unimaginable stress, taking care of individuals under very difficult circumstances. So the way I get through it, I just focus like a laser beam on what my job is and what I need to do. And all the other things I have to consider just putting aside, as my daughters used to say when they were kids, just suck it up and do it, period, and not be worried about things.
Dr. Anthony Fauci, we cannot thank you enough for taking time of your busy day to join us here on GMA3. And I know I speak for millions and millions of people, not just here in the United States, but worldwide, when I say thank you for your service, not just during this pandemic, but over your entire career. And I hope you come back and see us soon.
Thank you very much, Jen, and thank you all. Good to be with you. Thank you for having me.
Yes, thank you, Dr. Fauci.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.